So the majority are men, 87%. As I said, very few Indigenous individuals. The average age of men being diagnosed is about 37 compared to 34 years old for females. 70% who are diagnosed are men who have sex with men, and 24% are people who report heterosexual sex as their exposure to HIV. 38% are in individuals from a high prevalence country. So that means they've come from a country where HIV, as I said, is in at least 1% of the population. So that could be, you know, Southeast Asia, Sub-Saharan Africa, Ukraine, any of those countries. Country of birth, so 55% of people who've been diagnosed in Australia last year were Australian born. 42% were born overseas, and a small difference of people that we don't know their country of birth. 42% were born overseas, and then of the ones born overseas, Asia makes up the highest proportion, I guess. So 17% of the number of people born overseas are from Asia, followed by Sub-Saharan Africa, about 8%. I think that equates to about 110 people. So focusing on Victoria now, so these are data from the Department of Health. There are about 6,400 people living with HIV in Victoria, so that represents around a quarter of all Australia's population living with HIV is in Victoria, and 14% live outside of the Melbourne metropolitan area. Last year, or 2012, sorry, we had 260 people diagnosed, and that on average the last 5 or 6 years we've been having around 260 people diagnosed every year. And around 20 are in regional Victoria. Around 20 to 30 are usually women. So on average between 20 and 30 are women, and we have about, I can't think off the top of my head, maybe it's in another slide. Oh, there it is there. So 20% transmitted through heterosexual sex, and very low rates among Indigenous population and very low rates among injecting drug users. So this is what it looks like in Victoria. So 92% males. The men are slightly younger, 35 years is the average. Females is 30 years. 77% are men who have sex with men. 18% in 2012 were people who reported heterosexual sex. And down the bottom, place of birth, 10% of those born overseas are from Southeast Asia and 4% from Sub-Saharan Africa. So for the purpose of forums like this, where we see people from the sector who services and provide support for people from migrants and refugees, it was important to have a look at those individuals who've come from Southeast Asia and Sub-Saharan Africa and other countries, and just characterise them. So just to recap, 76% or 77%, sorry, MSM, men who have sex with men, 10% women, 33% born overseas. And in Victoria, we've got HIV disproportionately is represented among Asian men and Sub-Saharan African women. So just as I was saying before about the Aboriginals, even though the numbers are small, we have the same population rate of HIV. Well, with the people from Asia and Sub-Saharan Africa, the population rate is much higher than it is for the Australian born. And this, of course, is important, as I said, for service provision and health promotion for these groups. So just a small kind of analysis that I did was that I looked at those people who were newly diagnosed with HIV who'd come from overseas within the last 5 years. And I was thinking that 5 years was kind of representative of, or represented more people who were had other priorities, settlement priorities, for example, and other issues in terms of their arrival to Australia or Victoria, and they may be more vulnerable in terms of not being able to negotiate the health system and that kind of thing. So I kind of chose 5 years as representing that population. And what I found was that more than half were diagnosed within 5 years of arrival, of all the people diagnosed, born overseas. And then almost half of them were gay men born in Asia who acquired their infection in Victoria. Half of those, so we're talking about 100 men here, were aged 20 to 29 years, and a quarter of them tested for immigration purposes. 2/3 of them acquired their infection in Victoria. So to me, and after speaking to people like Alison and Maureen and other people in the sector who work with individuals from migrant backgrounds, that sounds like these are young men who are able to, I suppose, have sex freely with other men in Victoria, potentially not aware of the risk of HIV here, and acquiring their infection here. A lot of these guys, when we look at their testing pattern, they're diagnosed on their first test. So there's a lot of health promotion occurring for gay men in Victoria. So there's a lot of gay men who routinely are tested and screened for HIV. And when we compare the Australian-born to the non-Australian born, the non-Australian born ones seem to have no history of testing, rock up for their HIV test, and are found to be HIV positive. There's a substantial number of sub-Saharan African women acquiring their infection. They're different because they've arrived to Victoria, are tested at some point during their settlement process, and are found to be HIV infected, and usually they've already acquired their infection overseas. So 90% of them have acquired their infection. So it's a very different demographic and different epidemic. This is just a graph showing the growing pool of people living with HIV in Victoria. And it's important to see that after the introduction of antiretroviral therapies, we've got far fewer deaths from HIV, we've got a lot less AIDS developing, and we've got lots more people living healthy lives. And now there's an issue around, because HIV is relatively new infections, it's about 30-something years old, and now I guess there's an issue around health in terms of ageing with HIV. So there's this growing population of ageing, otherwise healthy individuals. And my final slide is just to show, and I guess this is related to what I was talking about before in terms of identifying vulnerable populations and people who've been diagnosed within 5 years of arrival. When you look at males and females who are diagnosed in Victoria, the females by far, the majority are women who were born overseas and might have issues around service provision and accessing healthcare and that kind of thing, compared to the males. And that's probably because most of them, that's 74% of males, most of them will be Australian-born gay men. But there's still that 26% of overseas-born men too. So messages from this. Australia is a low prevalence country, but we still get around 1,200 new infections a year, and we've got over 26,000 people living with HIV. We've got a growing pool of ageing people, otherwise healthy people living with HIV. Testing, treatment and prevention. So I had these there because it's important to, I guess, think about testing early, encouraging people to test early, providing services to reduce barriers to testing early, because there is good treatment available, and we have to also think about prevention and health promotion for people who are not infected with HIV and arriving as migrants or refugees. There's a need for culturally appropriate services. They are available, but they require continued support. I'd like to acknowledge MHSS. for, I guess, their support with my work. HIV STI surveillance team at the Burnet Institute, the Victorian Department of Health, who fund all of our surveillance work, the Infectious Diseases Laboratory, Kirby Institute, other clinics and laboratories who contribute to surveillance, and of course the community and sector.